Let's circle back to something you had mentioned, and that is the much higher rates of severe infection and death in people of color from COVID. And I think everyone knows that. It was basically all over the news and has been. You and I both do work looking at the unequal health outcomes based on people of color and poor people and underserved communities. But all of that was, laid bare. All the curtains were open, saying this is what we're talking about. And I think that's something that our community has known about for a long time.
Right.
And now is really hitting us in the face. And so we have this really, I guess, a juxtaposition of we're dying more of this infection.
Right.
Here's this potential protective agent.
Yes.
But we have fears around that. And I'm hoping that what we're talking about today will help allay some of those fears. So one of those questions I think that comes up around the fears is the speed at which this vaccine was developed. I mean, even the name, Operation Warp Speed.
Right.
And so can you talk a bit about how long, though, this technology has been around and that this isn't really something that was just developed yesterday?
That's right. And the technology for this particular vaccine has been around about 20 years now. I think it's also important to note that it is different from typical vaccines that we have talked about in the past, because this is not a part of the COVID virus, the coronavirus. It is not the whole virus. It's not a killed virus. It's not a part of the actual virus. This is the genetic code for that little spike protein around the virus, and that's what causes the virus to attach to tissue in your body. The spike protein itself is not infectious, but this is not the spike protein, it's the genetic code for it, the mRNA or messenger RNA as we call it. So what it does is take the genetic code in an envelope of lipid or fat, because something has to carry it inside. And it causes your body to use your own protein-making machinery to make that spike. And then your immune system recognizes the spike as being foreign. And then it makes the antibody, the protein that creates the protection against the coronavirus. And then it disappears. It doesn't integrate into your DNA. So that was new technology. So I guess we could say it's synthetic. It's not the actual virus. So you cannot get COVID from it. If you get it, you then don't test positive for COVID because you don't have the virus. Right.
I think it's a big deal to say that again. You do not get COVID from these vaccines that we're using now, Pfizer and Moderna.
That's right.
And because I was actually doing a radio show here in town with a community leader, and he was very supportive of the vaccine, and he made the statement, one of those things we had to overcome, that something his grandmother told him was, why give me a shot of something that I don't want to catch in the first place, right? And so this, in fact, goes away from our old way of doing vaccines, and that is that we've actually taken a step back from the actual infectious agent just using the code, but the code doesn't stay. And I know amongst particularly women, but I'm also hearing even young men of childbearing age, there are real concerns about that a vaccine of genetic material and what it might have an impact on their children and even them going forward. And so at this point, we have no data to suggest that this is not going to work and will be harmful to young women or to their outcomes from pregnancies.
That's right. Now, to kind of address the speed at which it was developed, research takes time, and so we do one step, and then if that seems to be successful, we move to the next step. They could have been done at the same time, but that's why put the money here
Right.
if it's not going to work,
Right.
right?
Right.
And so with this vaccine development, some of those steps that would have been done sequentially were done at the same time.
Yes.
The other thing to note about it is usually we wait until the end of the process to know that it's safe and effective, and then we start making it.
Right.
But what we did this time, because it was a pandemic, we started making the vaccine in advance. Now,
Right.
if it didn't work, we would have had to throw that away along with the money that we spent
Yeah.
on it.
Yeah.
But as it turned out, because the technology has been around, it was successful.
Right.
So it wasn't that we rushed to do it and skipped steps. It was just that we were able to move faster, and we produced it before it was known to be
Right.
safe and effective.
Right. And in fact, this dates back to before SARS and Ebola time, and I think
Right.
many people may not remember SARS, but it was
Right.
a coronavirus that was actually much more lethal.
That's right.
And burned itself, fortunately, was able to be contained before it
Right.
got out into the broader community.
And Dr. Corbett worked on that as well.
Exactly.
Yeah.
And the Ebola scare, I think everyone knew about.
Oh,
and
yes.
it was amazing that there were people who were even anti-vaxxers asking about an Ebola vaccine. That's
Right.
how afraid they were about
That's
Ebola.
major, yes.
But the technology that we have sort of came from that, and until now, it didn't have the, I guess, motivation to
Right.
put as many resources behind it to push it.
Right,
But it
right.
came and it was done. And so this is not something that's produced overnight. It's been, the
Right.
technology has been honed and developed, and we actually did have clinical trials that you participated
right.
in. And I looked at some of the data from the Pfizer and Moderna trials, and they talk about them being, both of them, over 94%
Oh, yeah.
effective. And so that meant that amongst the people who got the vaccine, that there was a much smaller number of them that got infected, period.
Right.
And in fact, between the two trials, only one person had a serious infection who, in the group that got vaccinated, and that person was after the first vaccination, not even after they got both vaccines. No one had a serious infection. So it saves lives.
Yes.
And we know that there are whole families that have been involved with
Yes.
multiple members of the families
That's
being
right.
lost, and nobody wants them to go through that kind of hard day
Exactly.
anymore.
Exactly.
So the Hank Aaron, our Hammer and Hank from Mobile,
Right, right.
one of our most favorite sons, if not our most favorite
That's
son,
right, yes.
had an untimely, unexpected death.
Right.
And it came, 18 days or so
That's
after
right.
vaccine, after having the vaccine.
After the first one.
And he had that vaccine in a very public appearance, doing it with other leaders in the Atlanta area
That's
who
right.
are advanced age, like he was. And so things have gotten started to say that maybe that led to his demise.
Right.
So what would you say to those people?
Well, I would say that there has not been any evidence that it was connected to the vaccine. So if you say, well, you can't disprove it either, I can't. But like you mentioned, Andrew Young, who was a year older at 87, got it the same day at Morehouse in a clinic there. And so did Louis Sullivan, 90 years old. So sometimes things happen that are not related. We would have expected maybe it would have been closer to the dose if that were the case. But I can tell you from my own experience, before I got the second dose, a couple of days before that, my asthma flared up. Not bad, but I was at work, didn't have the inhaler with me. By the time I got home, I was fine, didn't think about it. The next day, it happened again. That next day, I got the second dose of my vaccine. So if the flare-up of my asthma had occurred the day after I got the vaccine, there would have been some speculation the vaccine did it, when in fact it just happened at the same time.
Right.
So things do happen, but what I tell people is we live in a world of risk and benefit every day. That's what we do. Even when we get in our car, we don't expect to have a car wreck, but people die of car accidents every day. So it's what we're used to and what we're not. But I look at it this way. We know, as you said, it disproportionately affects African Americans. We're a larger percentage of the cases and deaths than we are of the population.
Right.
So it has proven what it can do to us. So you either trust that you won't get COVID, or if you do, you'll do fine, or you trust the vaccine.
Right, exactly.
And with me being asthma, related, and knowing what a respiratory vaccine already did to me, I was anxious to get that. Now, I might have gotten COVID and done well, as a lot of younger people say, but I might have taken it to somebody else who didn't do well.
Exactly. Exactly. And I think that's one of the points we should try to hit home, is that you do fine. And, there's this period of time before you even get symptoms, if you get symptoms, where you are out and about and passing things on.
Right.
And even the people that you had immediate contact with may never even get the infection, at least a clinical evidence of an infection, but it could be the person 2 or 3 steps down.
Yes.
They get it. And
That's
we've
right.
seen how fast it's spreading through our communities.
Absolutely.